So my focus currently is decarbonising Bayer's global clinical trials. And if we look at carbon as a transmitter for where we're creating waste, that's both waste of money, waste of energy, waste of resources, we can then use that as an excellent place to save our finances and have greater value for our assets. So this means that by focusing on sustainability, we're also unlocking economic value to invest even further in sustainability, where we can then identify these continued win-wins where reducing waste saves money. We can continue to unlock value into the future. So this is not a kind of a short-term fix. This is a long-term strategy to continue to realise value. I think there are 4 essential things. It's courage, creativity, connectivity, and future-conscious leadership. I think we'll know that the CSO really means business when they're planning quite far in advance for resilience of their organisation. We can have short-term examples of good practice on sustainability, but they must link to long-term resilience of the business. I would also say that, pre-competitive collaboration while organisations are thinking about where they can have most impact, that can really be a key role for the CSO, where they can identify potential positive impact by working with maybe creative partners in their sector and across sectors. We have incredible and very loud collective voices within our communities and within our sectors. And where we use that to a much greater extent, we can really galvanise society around positive change. And I think there's increased levels of trust in certain areas that we can also develop and expand on to ensure that society really understand what our intent is and can help support us in these policy changes. A key focus for me, and something that I spoke at Anthropy this year, is about the pharmaceutical sector's role in prevention in healthcare. Because I'm very interested in ensuring future generations have the opportunity to thrive, the patient that has the lowest impact on the environment is the one that doesn't have to go to a healthcare provider, to the hospital or to the GP. And where the pharmaceutical industry already does play a significant role in prevention through some of the ways that we work, we can do better. And I think focusing on prevention as part of a business model is actually a really excellent way to deliver resilience too. Because we're really then involved in the system, we can help to co-create these delivery methods, we can work with local communities where we have our industries. And that's somewhere I think that can be really explored, because then it also has even greater knock-on positive effects for society and for the environment. So in pharmaceuticals, where I work, our purpose is to improve human health. When we say that we're doing everything for the patient, this has to include minimising the negative environmental impact that healthcare has on the environment and on society through health equity, for example. So it is only through improving sustainability in our business models and our strategies that really we're driving sustainability. And this is kind of a positive feedback loop. So the better we do, the better we do.